Thanks, Mr. Chairman. Mr. Secretary, welcome back to the committee. Thanks for taking the time to be here. As you know, as a physician, I know the importance of protecting Medicare for future generations, and stopping waste and fraud and abuse are critical for all of us, and it's a bipartisan priority. Late last year, I was joined by my colleagues on the Comprehensive Care Caucus in sending a letter to CMS, and the purpose was to point out the proliferation of new for-profit hospice providers. And I think about the hospices in Wyoming, Central Wyoming Hospice that I'm very involved with in Casper. We have some around the state of Wyoming, community involvement, people volunteer, go to events, raise money, help, and these are amazing centers that provide care and comfort and compassion. Most troubling is that your own data shows many hospices now who are the proliferation of these new for-profit hospices, they're actually sharing the exact same addresses. I'm trying to figure out what exactly is going on here, why this is happening, and do you share my concern regarding this pattern of this sudden growth of these Medicare-certified hospices in certain parts of the country?
Absolutely, and we've actually conducted some unannounced site visits at some of these hospices that were identified in that article.
Yeah. What are you finding out in terms of, are there bad actors out there? Are there things we can do to curb them so that we can prevent some of this waste, fraud, and abuse?
We will absolutely share some of that information, but no doubt that what we're looking for is to find out if they're taking advantage of people, if they're defrauding the American taxpayer, and if they're abusing of the privileges that they have by being able to provide these services.
I'd point out there's a bipartisan group on this committee and in this body that want to assist you in that and help you and share the information that you come up with so we can put an end to this sort of thing.
As someone who cared for his dad, offering hospice care as best my family and I could, we are absolutely with you on that.
Thank you. The next is, rural health remains a top priority with me. I met today with the Wyoming Alzheimer's Association. There are a number of people here in the audience today listening to you testify, wearing the sashes representing family members and others with Alzheimer's. So I am encouraged that there is a new class of Alzheimer's treatments. It's giving families some hope that they may have more quality time with their loved ones before the disease takes hold. It's not a cure, but there's hope there. And we just need to make sure that what's available in certain locations could also be made available to our tribal communities and to our rural beneficiaries. The Center for Medicare and Medicaid Services, they have a policy for coverage that is with evidence development. And then it's requiring additional clinical trials or registries that could create logistical challenges for people in rural areas, as well as the providers who are trying to take care of them, because they're not all eligible based on where you are. So how is CMS plan to ensure that those with Alzheimer's in rural settings and tribal communities gain access to therapies which are currently FDA approved?
And Senator, I think this is where we all would agree we have to do more work together, but COVID taught us that telehealth flexibilities let us reach people more directly, more efficiently. We would love to keep those telehealth flexibilities in place. We would like to make sure that an actual skilled, specialized provider is available in these rural communities, so we're trying to expand the number of people who actually go into the profession. But this is where we can all team up together to figure out how we better serve our communities, especially in rural America.
Yeah, and specifically with FDA-approved drugs, unless you're part of this next generation follow-through, harder to get those, can't actually get them in rural communities, tribal communities, based on your location, even though that it is FDA-approved.
Yeah, we look forward to working with you on that subject.
Thank you. Then I wanted to get to rural health clinics. There are about 5,200 centers for Medicare and Medicare services, certified rural health clinics. They provide outpatient services to all across the country. The Census Bureau no longer defines urbanized areas. It was previously defined as urban areas of 50,000 or more. They've kind of changed that. But the rural health clinic statute requires that the rural health clinics must be located in areas that are not an urbanized area as defined by the Census Bureau. So they don't define them anymore. So there's kind of a lack of policy. So what we're seeing is that rural health clinic applications are currently being either inappropriately rejected based on assumptions of what the new policy is or blocked by states waiting for some clarification from CMS. And I know you're aware of this. Could you just hold forth on that for a bit?
Yes, thanks for pointing that out. CMS is in the process of trying to provide some guidance to clarify that. But, Senator, I will say this. If there is a particular facility, clinic, that believes it was denied access to funding and so forth as a result of what the Census Bureau did, please have them contact us.
We'll do that. Thank you, Mr. Secretary. Thanks, Mr. Chairman.
Before he leaves, I just want to thank my neighbor. Those are important points with respect to rural care. And I'm not aware of these for-profit hospice issues the way my colleagues talked about them. So I'd like to know more about those as well.
Well, thank you. Thanks so much, Mr. Chairman.
I thank my friend.